No, because there's...
I'm evil.
I do not believe so. I think that's what makes America great, and why we have more medical innovations than anywhere in the world.
Ask anybody on either coast. I'm evil.
No.
I start companies, I employ people, I pay them a lot of money, and I'm evil.
You should be ashamed of yourself.
I know, I should be, but I'm not.
How dare you, sir? No, I think, what is the standard, for example, that we use in determining a flu death?
Is this his dad?
Do you need me to wear a mask, by the way?
No.
Okay, nice to meet you. Do you need me to wear a mask for you?
No,
You okay?
I'm concerned.
Okay. Turns out people don't give a rat's ass. On with Dries. So you were asking, can you actually spell your name for me for the camera?
Dries, D-R-E-E-S.
Not Drew Brees.
No,
He's been in a lot of trouble lately for saying that we should, unify. So yes, I do believe, I think statistically, at this point, it's pretty hard to argue against the fact that the COVID death numbers have been inflated dramatically. Well, I come to the conclusion from a few, from a few numbers. Well, first off, let me ask you, do you believe the current death totals that we have, that's an accurate assessment?
I have no idea. That's why I'm asking the question.
Perfect.
Well, I don't know why you wouldn't think it is. I don't know why someone would lie about it.
Well, I think there are a few reasons that someone might lie about it or might be dishonest regarding that. And that's number one. Let's start where there might be an incentive and then the statistics that might bear it out.
All right.
Hospital right now gets significantly more revenue if they have a COVID patient versus a non-COVID patient. If they list a non-COVID patient, for example, it might get $5,000 in revenue in some kind of federal relief, United States government relief. They might get up to $13,000 if it's a COVID patient. Now, I understand there are experts who've been on both sides.
Is there a DRG code for COVID?
Yeah.
There's a diagnosis-related group code?
Yeah, there was. My wife was just in the hospital.
Okay,
they were asking her about it. Yeah.
Interesting.
As far as I understand, I don't know necessarily if it's a DRG code or a separate code, but my wife just came out of the hospital with GBS.
Because that's...
Interesting. I didn't know the conspiracy theory was going to start out right like that, but yeah, okay. So that's the conspiracy theory. The idea is that people are basically being submitted into hospitals at higher numbers because the hospitals will get more money from them. So it's all part of a massive scam. You see, a scam for the hospitals to bring in patients as COVID patients instead of other kinds of patients, and that's how hospitals work.
Big deal.
It's a DRG code if you're in a hospital.
Well, then that would be it.
I know a lot about hospitals. Go ahead.
Great. So I do tend to agree with Dr. Burks that it's inflated up to about 25%. Specifically, at least 25%. And let me present to you why I think that's the case. In New York, are you aware of how many of the COVID deaths are actually just not tested at all?
No idea.
25%.
Okay.
No testing at all. In Colorado recently, they said, well, hold on a second, we need to get some more accurate data here because, as you know, listen, there's a lot of data that comes in, and I do reserve the right to change my mind because data does change, especially in the pandemic.
And there's a lot of deaths.
Right. There have been a significant amount of deaths.
Are you telling me
in
that...
Colorado,
Okay,
in Colorado, they decided to finally differentiate between deaths from COVID and deaths with COVID because, like New York, every single death where COVID was found in the system was being counted as a COVID death.
Correct.
So they said, we're going to differentiate that.
That makes sense.
The death total came down by, and they're the first state that did that. Colorado. The death state was reduced by how much, do you guess?
I don't know, 25%.
25%. Every single death from nursing.
I don't know what's going on with the cameraman here, but the cameraman is really making a point to film people with masks. Like, dun, 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 dun. And now we're back to the sign. So nice. I have noticed the sources are popping up on the bottom though. Justthenews.com. Justthenews.com. Okay. It's a little bit of a blog looking like. Less of a news source and more of a blog. The Bentley Media Group LLC. Interesting. Oh, so they are rated right to nearly extreme. These media sources are moderately to strongly biased towards conservatives, causes through the story selection and or political affiliation. They may utilize strong loaded words, wording that attempts to influence an audience by using an appeal to emotion or stereotypes, publish misleading reports, and omit reporting of information that may damage conservative causes. Some sources in this category may be untrustworthy. All right. Hey, they still get a high on the factual reporting. Well, anyways, I don't want to ad hom right out of the gates. But yeah, so we got Just the News as the source.
Homes in the last several months. Every single death, regardless of a test or not, has been listed as a COVID death in the United States. 25% of all deaths in any given month in the United States come from nursing homes. So when you look at all those numbers in tandem, and you see how every death, or in most states certainly, except for states like Colorado, death with COVID in the system is being counted. And as we revise those numbers, there seems to be good reason for experts like Dr. Burks, and I mean, there are several experts on all sides, obviously. We had experts who said we would have 2 million deaths from the Imperial College in London, and Neil Ferguson, I believe, had to resign. I think there's a pretty strong case to be made at this point that the death totals, which are the most reliable indicator we have been inflated.
So let me ask you a question. How would you confirm?
Would you mind moving in a little bit?
Sure.
I don't think anyone
After
can hear.
a death, how would you confirm that it was COVID? Do you do an autopsy? What do you do?
Yeah. Well, we should at least do that.
No,
at least do something.
what is done?
Well, right now it's just a COVID test. So in other words, if it comes up positive for COVID, period, it's a COVID death. Let me ask you this. Do you believe that George Floyd had COVID in his system? Do you believe he died from COVID?
No.
Okay, neither do I.
Right.
And a mere few weeks ago, that certainly would have been registered as a COVID death. So it's tough because we don't have the statistics on every single COVID case. But here in Texas, actually, a good example. Are you aware of the first COVID death in Texas?
No.
First COVID death was a 97-year-old who already had an underlying condition. I've been trying to search high and low for the underlying condition. Can't get access to it anywhere. I would list maybe underlying condition that he's 97. That could be one of the confounding factors there. But go ahead, I know you have a question.
No. So what you're saying is there is no autopsy done routinely on patients that die who have COVID. Therefore, you can't really say whether they've died from COVID or something else.
No, that's not. I'm actually saying it's worse than that, in that there are definitive cases where doctors, health professionals know that the death is not the direct cause of COVID, and they list it as COVID anyway.
Because you're saying because there's a financial incentive? Is that what you're
There are quite a few
insinuating?
incentives. I mean, there's no doubt. I mean, I think we'd probably agree that it's been politicized for better or worse at this point.
Oh, yeah.
I was like, okay, well, I'm just waiting for the motive, because these are outrageous, outlandish claims, right? And if anything, it's actually been kind of in the opposite direction, that countries are underreporting the amount of COVID deaths they're experiencing, because obviously no one wants to be seen as having the high score in the game of how bad you are at handling a pandemic, of which, by the way, the United States is winning. So there's a huge problem of people reporting COVID deaths, such as pneumonia deaths, as something other than COVID-19 deaths. That's definitely been the case. In terms of there is some kind of, I guess, political expediency to what he's talking about, and or the idea that hospitals are doing this as a grift to make more money. That's not how the medical system in the United States works. It is a for-profit system, however. So maybe his argument coming up here is going to be that we should make it a public healthcare system instead. Maybe one that has a single-payer system. I'm not totally sure. He might just go way in the opposite direction and say that we shouldn't be profiting off of healthcare, because ultimately that's kind of ghoulish.
And so that's why you have experts who come out and say, right, everyone said, if you don't believe the experts, you're anti-science. If you don't believe 2 million dead. Remember at one point they said, don't wear masks, you're anti-science. I was advocating masks when they said, don't wear masks. We actually started selling them. We didn't actually sell them, but we had a sponsor who was producing masks, turned their entire factory for masks. And we said it's good to protect other people. At this point, people like myself were being condemned by the CDC. Then they said, if you don't wear masks, you're unscientific. Right. Then they said lockdowns to flatten the curve. Well, not only do we flatten the curve, we put a lot of hospitals into bankruptcy and doctors and nurses out of business because we never had the same surge that we expected. We just had that recently with my wife in the hospital. She had a minor procedure. And then she came out with GBS. I don't know if you're familiar, it's a central nervous system damage. And she wasn't able to get the kind of care that she needed. She couldn't get a bed because they had to have it reserved for COVID patients. Right. She couldn't get an MRI done. It took a day and a half because the rule in the hospital was every single MRI machine had to be reserved for COVID, except for one. Do you know how many COVID cases they had in that hospital at the time?
Probably zero.
Zero. And so I do think that we need to look at the overall ramifications. And I think certain people haven't looked at all of the above. And the reason I think that they are inflating the deaths is because it's been politicized at this point, for better or worse. They want to blame the United States government for not being prepared for it, for the same reason they said 2 million dead, that they've advocated lockdowns and continued it. There is a financial incentive. And I think a lot of the time people just don't want to admit that they're wrong. So when you ask, do I need to do an autopsy? I think at least doing that would be helpful. At least measuring these deaths as we do, for example, like the flu season of 2016 to 2017. 2016 to 2017 was the worst flu season I think we had. It might have been 18 to 19. And it was interesting to me because when I was looking it up, trying to find the worst flu season in the last 2 decades, this was me doing research, I saw a number keep coming up, 85,000 deaths from the flu. Turned out the number was 62,000. And the reason for that was because they revised that number and said, actually, these people weren't really dying from the flu. They happen to have flu in their system.
Right.
We're not doing that with
system.
COVID.
They died of heart attack or whatever.
Right. And I would even go and say, if someone has, for example, a mild condition, let's say like a heart arrhythmia, and COVID causes complications that abnormally they have a heart attack, that should be a COVID death. Mm-hmm. But we have such extreme cases and so many cases.
Well, this is neat. I don't know if a lot of you are familiar of the old adage when people debunk themselves in real time, but if you're trying to prove that this is a political conspiracy, so that they're doing this because they want to have some kind of political gain to make the Trump administration look worse, why are they inflating the numbers? Why would they do that? What would the gain be if that is in fact the reason? Like, I understand the other aspect of it, the the tinfoil hat aspect, where you're like, well, the hospitals are doing this to make more money. This is how hospitals get rich. But if you're trying to prove that there's a political angle to this, they're not doing a very good job at it. Yeah, to own the libs. Libs being owned. And you gotta love, I mean, they're all going to be selective edits, right? So this one, he talked to him for 5 minutes. The guy started out, I like how he started out by saying he's an authority. I know a lot about hospitals. He's like, okay, well, good. So I just have to talk to you about these kind of facts and figures, and I think the numbers are inflated, and it's just a little bit strange. Not entirely sure where this is coming from. He changed his mind.
There's no confirmation of anybody who's died with COVID that COVID caused it.
No, not anyone who's died. There are many where no
Those
tests
countries aren't
have been
real.
conducted at all.
That's my point.
Yeah, but you said we haven't had confirmation with anyone. I do believe we've had confirmation with quite a few, but there are a lot where we've had
That
no
it was a
testing.
COVID death. Okay,
Yeah.
and there's so what is the confirmation of a COVID death? What is the official confirmation of a COVID death? That's,
Right.
I think that's what would be interesting to know.
I think that's an interesting. Now you said you know a lot about hospitals. Are you a doctor?
No.
Okay. You work in a hospital or with hospitals?
No.
Oh no, you don't work with the evil health insurance or big pharma. Okay, good. All right. Doesn't have to do-
I invent complex medical devices for doctors and hospitals.
Oh, well, there you go.
I'm an inventor.
Thank you for doing that here in the United States.
I'm an inventor.
I
I start companies and employ people.
In Canada, I was originally raised in Canada. Do you know what we call you? Figments of our imagination.
Bad.
Yeah, they don't exist anymore.
Bad.
No, because there's.
I'm evil.
I do not believe so. I think that's what
I'm
makes
evil.
America great, and why we have more medical innovations than anywhere in the world.
Ask anybody on either coast. I'm evil.
No.
I start companies. I employ people. I pay them a lot of money, and I'm evil.
You should be ashamed of yourself.
I know I should be, but I'm not.
How dare you, sir? No, I think, what is the standard, for example, that we use in determining a flu death?
Is this his dad? Did his dad? Oh, I got you, son. Don't worry. Yeah. Let me do one of these. I know exactly what to say.
I don't know.
Okay.
That's a good question.
Yeah.
I don't know, because that could also be misconstrued by a lot.
But we do have a standard, and we do have a season, right? Now, flu, if you look at a flu season, it typically goes from fall to spring.
right.
And then it resets. That's how you determine.
October to the end of March and it resets.
Right.
Science.
Some years it'll go to April if it's still severe, depending on the curve.
It depends where you live.
Why right now is the ticker, when you watch CNN, still going with the same season, even though we're coming up in July soon? Is that comparable to the flu?
Well, not yes and no, because at least in my ignorance, they're saying that weather is not really an issue with this COVID virus. I have no idea whether that's true or not, because we told a lot of other things that they backpedaled on.
Right.
60 days after they told us something.
Yeah.
So I have no idea whether that's true or not, but if you believe that it is not weather related, then there really shouldn't be a cutoff on it.
They haven't been saying that
Kind of
either.
what we're talking about.
But I don't know.
Okay. The Nova, it stands for novel. It means new, as in we're just learning things about it. Yes, it's very mysterious in a lot of ways. Scientists are working around the clock to figure out these kind of things. Having people like you on the streets spouting, I don't know, tinfoil hat, fever dream gibberish doesn't help any of this. And again, let's remember, he's not a doctor, he's not a scientist, he's an inventor. He invents devices, of which that could be anything. I mean, if you invent fleshlights, technically you are an inventor of something that is going to contribute towards the medical community in some form, can help some people relax.
We've had so many contradictory things told us
Right.
that it's hard to know what's
in the bag.
So would you like to know what's something that is real?
You and me having this conversation.
Yeah, we'd like to know something that is real.
About Israel?
That is real.
Oh, I thought you said about Israel. I was like, oh, no, you're going to come up
That
with
is real.
Yes.
Oh. My masky sense is tingling. All right, let's skip from the fellatio onto the next one. Ooh, we have a mask wearer. Okay, this looks like a goddamn hippie. I think he's gonna get ripped apart. It looks like he's actually wearing an N95, the official medical grade mask. So let's see.
For the same reason that Dr. Birx has expressed that she believes it's about inflated by at least 25%, and a lot of healthcare professionals have. Let's go through a couple of instances. So in New York, 25% of all COVID listed deaths were never tested at all.
Right.
Did you know that?
Yep.
They were never tested, just listed as guessed COVID-19. Then are you aware of what happened in Colorado? And by the way, none of these are trick questions. A lot of people aren't necessarily aware of these. Are you aware what happened in Colorado?
Not offhand. Go ahead.
So they said that they needed better data. And listen, let's both agree that data could change tomorrow. So something that we could say today could be wrong tomorrow, both of us, right? Especially when it's a pandemic and it's a new mutating disease. In Colorado, they said we need more accurate data because this is much like New York. Everyone who dies who has COVID in their system just lists as a COVID death. That doesn't really help us get a good picture of what's going on.
Right.
So they separated death from COVID. They separated that from death with COVID, where people happen to die within their system.
Right.
The number of deaths dropped by, take a guess,
25%.
about 25%. Then all nursing home deaths were listed as COVID-19 deaths, despite the fact that 25% of all deaths in any given month come from nursing home patients because they're very old.
Right.
And again, that removes 25%.
And it is true that a lot of people that have been dying from corona are your older patients. People
Absolutely.
that have pre-existing conditions,
Yes.
also of other things.
Yeah.
But
In
I
New
think
York,
with a lot
actually, the
of these
median
cases-
age for a corona patient death is older than life expectancy.
Makes sense.
Yeah.
So I think with a lot of these, even though it's
So it
the
doesn't
case
matter.
with corona,
I'm close, but no cigar. So I get put in the hospital, right? And basically put on life support. They're trying to help me survive. And I don't make it. And just before I die from my suicide, I get COVID-19. Is that a COVID death?
no. And I would think it would be one of these few outliers too. Does that
That
add up
is
to
literally a
25%?
COVID death right now.
But would that add up to 25%?
Well, it's tough to know because 25% of the deaths are never tested. So here's what we do know. 25% of the deaths are never tested. Anywhere we've said, let's separate that from death with COVID. We remove 25% off the bat. Anytime we look at a lot of these individual cases where we see these people who died with COVID, there are a lot of complications. Texas, I don't know if you're a Texas native from California yourself.
Yep.
The first Texas COVID death, do you know what it was? The first one registered as a COVID death.
Not offhand, actually.
And it's not a trick question because I was surprised. How old do you think the guy was?
I don't know, 60.
97 years old with a severe...
Okay, so we're basically getting the crux of everything that's happening here. He's basically cherry-picking a bunch of stats. He's pulling out a whole bunch of anecdotal evidence. Here's an isolated story. Here's another isolated story. Did you hear about story X that happened to person B? Well, that also happened to person C during story Y. So, yeah, I clearly see a pattern. I was just curious, where's this all coming from, though? Because, you know, we don't dip our feet into the ether rig that is, you know, the Steven Crowder too much. But it took like a 2-second Google search to find this out. Fox hosts now convinced coronavirus death tolls are being inflated. After downplaying their pandemic and praising Trump's response, right-wing media has a new spin. The mainstream press is exaggerating deaths to make Donald Trump look bad. So that's the rub. That's the whole point of all this, right? According to medical workers on the ground, the death toll from the coronavirus has been vastly lowballed due to lack of testing. As far as underreporting, I would say definitely. A nurse told the New York Times this week, describing patients who had tested negative for the flu, but who had died nonetheless. And yet, according to pro-Trump media personalities, the exact opposite is taking place. In their latest play to diminish the pandemic severity, Rush Limbaugh, Tucker Carlson, Brit Hume, Mark Levin, Steven Crowder, and others have come out this week to question whether the Center for Disease Control and Prevention's coronavirus data, with some accusing the media personally gunning for Donald Trump by reporting supposedly exaggerated numbers. There may be reasons people seek an inaccurate death count, Carlson said. When journalists work with the numbers, there sometimes is an agenda. Hume suggested that it is not a significant number of COVID-19 deaths that could be chalked up to the underlying conditions, not the virus itself, tweeting that at the beginning of April, the New York City's coronavirus fatality numbers have been inflated. Wow, where did we just hear all of this? A number of reports this week have found the opposite to be true, thanks to insufficient testing, particularly in the early stages of the outbreak. Experts say the full impact of the pandemic is nearly impossible to calculate. CDC spokesman Kristen Norden noted the agency's coronavirus death toll only counts patients who died after testing positive. We all know that is an underestimation. So yeah, this is basically just Tucker Carlson talking points.
Now, once again, we ought to celebrate all of this. Fewer hospitalizations are a godsend for this country. And as awful as this epidemic has been and will be, at least so far, it hasn't been the disaster that we feared. Our healthcare system hasn't collapsed. That was the key concern. Except in a handful of places, really, it hasn't come very close. Patients are not dying alone in the hallways of emergency rooms with physicians too overwhelmed to treat them. That was the concern.
Good? Can I get an amen or a thumbs up or a celebration or something? I don't know.
It happens in other countries. It's not happening here. Thank God for that. All of this means that the short-term crisis, the ones that we worried about so fervently, in which pressure on hospitals grew so exponentially day by day with no end in sight, that short-term crisis may have passed. We'll see, but it looks like it may have. Now it's time to look ahead. If the virus is doing less systemic damage to our system than expected, then presumably we can begin to consider how to improve the lives of the rest, the countless Americans who've been grievously hurt by this, by our response to this.
So here's the thing, okay? With any conspiracy theory, here's what you got to look at. Is this conspiracy theory going to apply as like a broad brush to everyone? So will it affect people who are rich, for example? So is the idea that cancer doesn't affect certain people because we have a cure for cancer? The cure for cancer actually exists. Does it affect someone who's very, very wealthy? And in fact, if Steve Jobs died from cancer, then that conspiracy theory kind of falls flat because he had all the money in the world and yet he still died from cancer. So maybe there's not a secret cancer cure in a lab or a testing ground somewhere. That one's kind of easy to debunk, right? When it comes to something like this, what would be the motivation? You have to look at them, think of it like a detective, all right? We get to be one of those famous, children's novelists or something of that sort. Not Harry Potter, because of course we know how evil that can be. But let's just look at it from this perspective. What's the motive for them doing this? So the motive is twofold. One, they're doing this because A, they want to foster power and make Donald Trump look bad and basically win the election. So that's why they want really high numbers. And how did they get those high numbers? by hospitals lying about death rates and also getting patients in there to make money as part of their conspiracy because they're politically motivated. Because these two things aren't compatible whatsoever, again, we can look at the Occam's razor of this. The simplest explanation is probably going to be the correct one. This is just the right-wing spin machine trying to, I don't know, propagate some kind of narrative that will inevitably... I don't know if this will even help Donald Trump. I don't think long-term that would actually be a thing. Coronavirus deniers are taking videos of hospital parking lots and claiming that this is evidence that the novel coronavirus is a hoax. In reality, hospital parking lots is down because visitors from most non-COVID patients have been told to stay home, and potential COVID-19 patients are discouraged from admitting themselves into the emergency, and said patients who suspect they have COVID-19 are encouraged to call their doctors first and visit an assessment center if necessary. The fact that hospitals aren't completely overrun means they are properly prepared for an outbreak response if in place. If coronavirus deniers are looking for a COVID-19 horror show, they have but to look to shelter systems or the hundreds of long-term care homes across the country, which have become new front lines. Yeah, that was the other thing I was going to bring up. It's really, really sad, but if you look at the footage of, old folks' homes across the United States, that's where you see just the actual horror show stories of just like beds upon beds of people on respirators. And yes, 5G is in the next generation of wireless communication technology. What started as a fringe idea on a French conspiracy website has now led to some setting fire to cell phone towers across Europe. And the claim that electromagnetic fields can cause COVID-19. I mean, that one doesn't have to go too far. We got people on this platform, this Twitch platform, who seem to think that and are allowed to talk about it and keep doing what they do because that's the thing.
Yeah, so like on a 1 to 10, with 10 being a 2 million and 1 being nothing, I'd say 3 or 4. So it's different.
Maybe even less would be a 2.
Maybe.
Yeah, especially if you reduce to 25%. But let's even take that number, 85,000, like you said, 80,000 deaths from a really bad flu season. And let's even take just what it looks like. But let's say it's 110 or 115,000 now. Here's 80,000. Here's 2 million.
Yeah,
right?
I guess.
So
I was skeptical of that when that came out at the time too.
Right.
I thought the second round of numbers that they had of about 200,000, which is probably what we're on track for now. It seems about right.
If we use the metrics of just counting anyone who dies who has it in their system, yeah.
Yeah. Well, and if we get the second wave,
right.
We'll see. Well, probably about this weekend when it goes, 2 to 3 weeks from when all these protests have been starting.
You think that might have an impact?
Oh yeah.
Why do you think the media has been blaming it on Memorial Day and not the protests? Not the riots.
They can't admit that it's been the riots that have been spreading it.
I think we would agree on that.
So that'll be interesting, especially around here. Like Dallas had those big riots first weekend.
Deep Ellum was trashed.
Yeah.
Completely trashed.
So we'll see pretty soon here what's going to happen. And of course, before that, Texas started undoing the lockdown.
Right.
I mean, as for me, I think we shouldn't have gone into. Well, it depends on the state. I think Dallas was okay, but or Texas was okay. Maybe.
Okay, let's turn to this leftist pinko commie publication, Scientific American. Yeah, there's a misnomer. As coronavirus has swept through the United States, finding the true number of people who've been infected and stymied due to lack of testing. Now, official counts of the coronavirus deaths are being challenged too. In Colorado, for example, a Republican state legislator has accused the state's public health department of falsely inflating COVID-19 deaths. In Florida, the local media have objected to the state Department of Health's refusal to release the medical examiner data to the public, alleging that the state may have underreported deaths. The reality is that assigning a cause of death is not always straightforward. Even pre-pandemic, and a patchwork of local rules and regulations make getting valid national data challenging. However, data on excess deaths in the United States for the past several months suggests that COVID-19 deaths are probably being undercounted rather than overcounted. Because, yeah, of course they are. Every country is doing this. Do you think for a second, Mr. Crowder, that Russia all of a sudden had a spike in pneumonia deaths, ones it's never had historically before? Like all of a sudden all these thousands and thousands of Russians are dying from pneumonia deaths? Do you think that's just like a coincidence? Or could it be that pneumonia is one of the things that kills you if you're infected with COVID-19 and they don't want to appear to have such high numbers as the United States does? No country wants to have enormous numbers. That's the game. This is part of the whole geopolitical dance everyone's playing right now. And that's why countries like China, which had very high numbers at first, are now kind of trying to enact soft diplomacy by sending doctors to other countries, because we're so wise and mighty and powerful, the great empire is, that we can go to other countries and fix their problems as well. Death certificates can be signed by a physician who was responsible for a patient who died in the hospital, which accounts for many COVID-19 deaths. Many COVID-19 death certificates are being handled by a physician unless the death occurred outside of the hospital, in which case a medical examiner or coroner will step in. Having medical examiners confirm COVID-19 deaths can create more uniformity and clearer documentation. On a death certificate, there are spaces to list an immediate cause of death, as well as a chain of events that led to the final decease of the incident. For COVID-19, the immediate cause of death might be listed as respiratory diseases, with the second line reading due to COVID-19. Contributing factors such as heart disease, diabetes, high blood pressure would then be listed further down. This has led to some confusion by people arguing that the real cause of death was heart disease or diabetes, I can say, but that is not the case. Without the COVID-19 being the last straw, or thinking that it led to the chain of events that led to death, they probably wouldn't have died. Whew. Took a long time, but my mind has not been changed, because that's pretty much it, right? So, yes, they probably could have died by heart disease down the road. They could have died by diabetes or complications therein down the road. That all is totally possible. But they died at here and now, at this point in time, because of COVID-19. And yes, there is underlying problems, but that's the cause of death.
Hey friend, thanks for watching. Before we bombard you with all of our shameless links, we want you to bombard us. Do you have a worker co-op business or local union you'd like us to advertise at the end of our episode for free? So, if you'd like ears on your worker co-op, go down to weareserfs.com. And while you're there, join the Discord, because it's filled with righteous guys, gals, and MPals. Finally, come check us out on Twitch Live 5 days a week by going to twitch.tv/theserftv. Yeah. To our lords, Ricky Pilgrim, I'm Raft, Tomospone, Nine Tails Cosmic Fox, Hans Josephine, and Corpse Harvester, we bow meekly for your pleasure. To our Knights of the Round Table, Josh Mickelson, Dylan Byte, Zach Christensen, Todd Buckingham, Todd Lajeunesse, Clement Chetskoff, Cooper Pilot, aka the Man with Large Balls, Political Puppy, Nick Davis, Ali May, and Alan R., we salute you. And to our many merchants and farmers, you have our undying loyalty.